Hello, I'm Terry Arnold from the IBC Network on Talk IBC podcast, and I have with me Sarah Norton. And Sarah was so generous to be willing to do a podcast and talk about her personal unique experience, but also talk about what it's like to be dealing with inflammatory breast cancer with a brand new baby and a toddler. She's up in the Chicago area and she's joining us today. Sarah, thank you so much for being here. And let's just jump right in and tell me about your experience with inflammatory breast cancer.
Sure. Yeah. Like you said, I had a baby in July of 2023. I had my little girl, Amelia. And in February of 2024, I stopped breastfeeding and I noticed some changes in my breast. And I attributed that to, weaning and stop breastfeeding. And so I was keeping an eye on it and I really thought, I probably have mastitis. It's probably a infection from breastfeeding. So let me go to urgent care or immediate care is what we call it here. So I went on a weekend on a Saturday to a doctor and I said, this is getting so painful that Advil's not cutting it, Tylenol's not cutting it, and I just need to get this checked out. And so he looked at it, and I give this doctor a lot of credit because he has seen all different kinds of patients all day, and he took me very seriously. He did an ultrasound in the office and he said, you know what, I'm going to get you on antibiotics, but I think there might be a little bit more going on here than just mastitis. He's like, so on Monday, I'm going to get you an appointment with, it was with a doctor who specializes in breast cancer. And I was like, what? Like it kind of caught me completely off guard. And I, at that point, actually wasn't even that worried. I was just worried that if this was an infection and it had been going on for so long, that I was worried about being like getting sepsis because it was going so long untreated. So I did not get any relief from those antibiotics and went to the appointment that they had made. And in the office, they did more ultrasounds and examined my breast. And they actually wanted to do a biopsy right there in the office, but I wasn't ready for that. I wasn't prepared for that. I didn't have anybody with me. I was very squirmish of needles at that point. So they actually booked me into like a real place where they do biopsies and I could get the numbing shot and everything. So that was on Wednesday, a couple days later, that they did the skin poke biopsies.
I have a question for the people that can't see you.
Mhm.
You're clearly a very young woman. You said you just had a
Yes.
baby, but the ones that are listening on Spotify, how old are you, if you don't mind me
Yeah,
asking?
no, I don't mind at all. I'm 32 and I was 31 when I was diagnosed. So this was not on my radar at all.
Oh, and it's interesting to me, and I don't want to go down a rabbit hole. People say, "Why didn't you get checked?" You could be old enough for a mammogram for another 10 years.
Hmm.
I mean, for
Yeah.
people, we need people to understand that there are breast cancers that show with outward visible changes. And this was not your first baby,
Mhm.
but had you ever had mastitis before?
No, I just knew that something wasn't right. And my right breast was almost double the size of my left breast at that point. And I was like, it's like a clogged duck or something is not right.
I nursed five babies and I never had mastitis, but I could understand why, even with subsequent nursing, that you could think, oh, this is mastitis. This is what I've heard about. I've never
Hmm.
experienced that. So I'm glad you were diligent. How long do you think it was between your first symptom to your diagnosis time?
So it was about 2 weeks. It was really quick, and I am thankful for that.
Timely.
Yes, it was very quick because I noticed I was like, this is uncomfortable, but it got to the point where I called off of work because I couldn't put a bra on because it was hurting so bad. And that was on a Friday. And then I was like, you know what? I just got to go and get this checked out. And Saturday, I couldn't wait until Monday. It was hurting so bad.
I understand that feeling. I was what I call a small C cup
Mhm.
prior to having breast cancer. And then I went to a double D overnight. It was just awful.
Yeah. Yeah.
I was not a busty girl. And that change was so dramatic. And they told me at 49 I had mastitis. Now, here you are with your brand new baby, and you've got a toddler, I'm assuming,
Yes.
about
He
what,
was
three
3 at
maybe?
the time.
Right. And here you are, probably feeling very out of place in this breast cancer world.
Yes.
What were the
And
next steps for you?
so it was actually interesting too when they were doing the mammogram and the ultrasound and the biopsies in the office. One of the nurses, who was so sweet and she was a very experienced nurse, said, "You know what, hon, I don't think this is breast cancer because breast cancer doesn't hurt like this." She actually said that to me while I was getting the biopsy. So that's why when I heard the word inflammatory, I'd never heard of IBC before, inflammatory breast cancer. And it's clear that a lot of healthcare providers also aren't familiar with it, because she was trying to comfort me in that moment. She's like, "I don't know what this is, but this isn't breast cancer. It doesn't hurt like this." And so,
I'm gonna put my hand up and back you up real quick here because when she doesn't hurt like this, I know people don't think breast cancer shows, hurts, whatever. I love the Know Your Lemons campaign. Have you ever seen that? It's a little egg carton with a dozen lemons in it, and each
oh,
lemon has a blush or a dimple or whatever. Because I think everyone should uh, tape that to their forehead and tell their friends about it, because those outward physical signs show. But it's interesting that she'd say it doesn't hurt like this. Was that in the biopsy moments?
yes.
Because I want to say something about that real quick. I go to a lot of research meetings, and one of the things I realize is when they put that numbing cream in the breast to do a traditional biopsy, for some reason for IBCers, it doesn't take right.
Yeah.
And because we don't have a lump and it's webby and diffused, the the numbing cream, they say it pools. And I've heard doctors say you can tell it doesn't dissolve right because the breast goes blue. It pools on the top of the breast. I'm using my hands like people can see me,
Mm.
but those of you on YouTube can't. It pools on the top of the breast and doesn't penetrate. And so we're down under there wiggling and trying to get away from that needle, especially if you're like me and you. I'm scared of needles.
Yeah.
You made it pretty clear you don't like them either. We're wiggling under that biopsy. They think we're being either babies or dramatic or whatever, and telling us it doesn't hurt this way. That's actually plastic for us
Hmm.
because that numbing cream doesn't work well.
Yeah. I
And
felt
I'm sure
everything from
she
the,
meant well, but that's so inappropriate for her to be dismissing what could be a serious diagnosis. So I wanted to throw in that bit of education because I've had women tell me they couldn't finish my biopsy because it hurt so
so
much.
bad. They did my breast first, and then they were going to my lymph nodes. And I was like, if my breast hurt that much, I can't imagine like my armpit. And that's why I was crying. And she was trying to be comforting in that moment, but it was so painful. And later down the line, I did get more biopsies at MD Anderson, and it was a totally different experience, much better. They gave me a lot more numbing agent and made sure I couldn't feel that needle before they did the biopsy. So,
These are things are good pieces of advice because sometimes women don't get to complete the biopsy or they don't get a full biopsy. And also, we do want to educate the doctors who are dealing with this that just like we need unique tools to be diagnosed, we need unique tools to get a proper biopsy. So you're in Chicago, you're doing all this in Chicago. Later, and I learned this from MD Anderson about the numbing and things. So what happens next
so
after your
once
biopsies?
I finished those biopsies, and about 4 days later, I was actually at work doing a presentation, and I saw I had 3 missed calls come through from the doctor's office. And in my mind, I was like, there's some infection going on. But when I saw 3 missed calls, I was like, oh God, my stomach dropped. I stepped away during a break, and my computer was still projecting in the room full of 20 people that I was presenting to. And I went down to my office and got the call, and they said, "Hey, Sarah, we have results. It's not good news. It's cancer. It's grade 3, so it's very active. And we want to get you in for further tests today." And I was just completely taken aback. I was frozen. I just left my computer upstairs in the boardroom and um, called my wife and went home, and I was just in shock. And so luckily, my brother, he actually does cancer research. He is a PhD, and he was one of the first people that we called and said, this is what's going on. And he's like, I want to, if it's okay with you, I want to come to all of your appointments with you. So we went and saw our doctor, and I'm very thankful they assigned me a surgeon and they assigned me an oncologist, a medical oncologist. And they met with me together and explained that I had inflammatory breast cancer. They could tell by the presentation. And I'm really thankful that they did that part right. And they explained that the treatment for inflammatory breast cancer is the trimodal treatment, where first we're going to get you right into chemo. So we have to place your port and then we'll get you into chemo. Then we'll look at having the radical single mastectomy, and then we're going to do radiation. So they were up to date on their plan. Um, but I got my CT scan and found that there was 2 nodules on my pubic bone as well. So that made me stage 4. So I was getting my port placed. I was getting ready to start chemo. So from the day that I found out that I got that call at work to the day I started chemo, it was only 10 days. So they moved quickly. They diagnosed me correctly. At first, they gave me the right treatment plan, but I felt once they found those little nodules on my pubic bone that there was a sense of giving up, because then my medical oncologist met with me and said, change of plans, you're stage 4. So now we're going to just give you palliative chemo. And I was like taken aback. No, 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 no. Like, you don't understand. I still want that surgery. I still want the radiation. I have 2 young babies. Like I'm 31 years old. I don't want to just do palliative chemo. So I had to keep working with him when I was really unhappy with him, just to keep the process moving and to get that chemo started. And at the same time, my brother connected me with one of his mentors in the cancer research field. And they got me connected with a doctor from University of Michigan who is very, very knowledgeable about IBC and has been working with IBC for years. And she actually gave my brother her personal cell phone. And this is the one thing that could make me emotional, because I went from being scared to death, thinking that I had weeks or months to live because of my doctor. And then when I spoke with her, her name's Dr. Sophia, and I don't know how to pronounce her last name,
It's
but
Sophia.
yes,
It's
you know
Sophia.
her?
I know who it is. I know her very well. We're very good friends.
Oh, yes. So she gave her personal phone number to me, and we had a 3-way call with her, my brother, and then my wife and I. And she just turned my whole perspective around in one phone call. And she's like,
Mhm.
Sarah, if you don't like your doctor, if he's giving up that easy, she's like, it sounds like you're barely stage 4. I've never heard that, like barely stage 4.
Really stage 4.
Yes. She's like, you got to keep pushing. She's like, have you heard? She's like, I would treat you here at U of M, but really where you should go is MD Anderson, because they have an inflammatory breast cancer clinic. And I was like, what? I live in Chicago. What do you mean go to Houston? But I,
Sophisticated city with a lot of things, but IBC is a rare disease. So,
Mhm.
if you can get close to the few IBC clinics in the world,
Mhm.
you're going to get best practice because they're creating what's the other places hopefully will follow. But to me, I'm very fortunate. I live in Houston and I was able to be treated there. But I tell people if you can, you're also part of the formation of new research. Then hopefully then we can also take that information back home. So then people aren't forced to travel. But I'm glad that you were able to do that. And I love the
Yes,
barely stage 4 part. And by the way, I always say you're not stage 4, the cancer stage 4,
stage
but
4.
I get what
Yes,
you mean. Yeah, I don't want us to lose ourselves in this process.
that's
We
true.
don't become our cancer, although it can be overwhelming. And so anyway, so what happened next?
Yeah, so that I got off the phone with her and I finally felt like I could exhale. And I applied or filled out the referral form or whatever it is on the website for University of Michigan and for MD Anderson. I'm like, I'm just going to put them both out there and see who gets back to me. The next morning, MD Anderson called. Like, it was such a quick turnaround. And they scheduled me for an appointment the following week. So that was huge. They reacted and responded really quickly. All throughout these couple of weeks, already had a couple infusions of the AC and Taxol. Um, and then we went to Houston, my wife, my brother, and I. My parents watched my kids, which I was very thankful for. And I love it. It was like a scene from Grey's Anatomy. I've talked to other people who've gone to the IBC clinic where you get all of the doctors. You have your medical oncologist, the surgeon, the radiation oncologist, and like the nurse practitioners. Everybody sat down and met with us, and it was a long day, but they redid all the tests, the scans, the biopsies. And again, it was a much better experience than my first biopsy. I was really scared to get biopsied again, but I'm glad that I did because I had had 4 infusions by that point, and my scans were already, my breast was already looking way better. And the nodules on my hip that were there originally had already like pretty much gone away. So I was already responding to that chemo.
Something in the cancer world, it might seem like an odd expression, but they say bones is best. You know,
Mm-hmm.
if somebody has to have a stage four spread, there's so much treatment for bones, and that someone can achieve NED, which is no
Mm-hmm.
evidence disease, after having a stage four diagnosis. And I'm glad that you kept asking. I know other women who were in the same place as you. I know for myself, I was told at my diagnosis they said I was misdiagnosed for 4 months by 5 doctors, and they said my I wasn't at MD Anderson at that point. I was at a place near NASA in Houston, major place, who said you have inflammatory, and it's because you've been misdiagnosed for 4 months. It's too late, and we're going to start you on palliative care. And I'm like, wait, you went from there's nothing wrong with you, you're crazy, to oh my god, we missed it, with nothing in between. This is
Yeah.
completely unacceptable. And but honestly, I'm a hopeful person. But when I went to MD Anderson, I truly expect to be donating my body to science. And they were like, "No, we think we can help you." I'm like, "You're kidding."
Mm-hmm.
And but what kept me in this world all these 18 years is women like you. I keep meeting women like you
Mm-hmm.
who need help,
Mm-hmm.
and that's why the IBC network is here. That's why we're funding research. That's why we're doing these podcasts. We want your story out there because we're
Mm-hmm.
told cancer doesn't show, cancer doesn't hurt, cancer
Mm-hmm.
has a lump, you don't get it young. And here you are,
Yeah.
opposite of everything. And
Yes.
you're doing okay.
Yes. Yes. And so I did meet with MD Anderson, and uh, I came back so hopeful from that. I was like, okay, I am going to go through these 3 stages of treatment and I'm going to be great and I'm going to be fine. And I thought that I'd take that treatment plan and go back to my home oncologist and be like, look, here's our plan. Here's what we're going to do. And that doctor who I am still not resolved with, I'm still upset with him. He said, oh, like kind of was like, oh, honey, that I can't believe they would give you this hope. He's like, sometimes there's hope and sometimes there's false hope, and they just gave you false hope. And I was upset because I had always had my wife and my brother with me, and I felt like he waited till I was alone to like have this conversation with me. And he tried to take the wind out of my sails, but I remembered my conversation with Dr. Sophia. I remembered my conversation with my MD Anderson team and was like, all right, you can do my infusion this week, and I am transferring hospitals, and I will
Out of
find
here.
somebody who will treat me. And with the help of my sister, she works for a Northwestern hospital as an event planner. She reached out to their CEO and just said, we have a plan from MD Anderson. This is her situation. Can you find us a doctor who will be collaborative? And they said, yep, we'll give you the best in the West. And they gave me my current medical oncologist, who I love. He definitely is collaborative and is happy to work with MD Anderson and follow their plan.
Mind sharing that name for the people who might be in the Chicago area?
Yeah, so his name's Dr. Manini, and he works for Northwestern in the suburbs. Dr. Manini.
Okay.
Mhm.
People call us all the time and say, hey, I can't, or I don't want to, or I'm having difficulty. So we don't mind naming names of people who are willing to
Yeah.
be collaborative. And I know my local doctor told me the same thing. She said, if you go there, don't come back. You'll be a rat in a cage. You'll be part of an experiment. I never felt that experience at
Mhm.
all. And it is big and it is overwhelming. And I'm a big believer in hope, and I don't believe in giving false hope. But I also see really wonderful success stories post IBC diagnosis. And
Mhm.
I think the harder we get the information out and the more we fund research, there'll be more women who are well. Now,
Yes.
so how many years has it been since you first started treatment? Tell me the numbers
So
again.
Um, I was diagnosed in April of 2024, so it's been 18 months. I completed the trimodal treatment. I went to Houston for radiation. That was kind of a tough decision if I wanted to stay home and do it or go to Houston. I decided to go to Houston. I was there last year at this time for 5 weeks away from my family. It was hard because it was over the holidays, but totally worth it. And I also had my mastectomy done in Houston. So I traveled for the surgery, came back a couple days after, stayed home for a month to recover, and then flew back by myself for radiation. And
A lot of women do that who are out of town because you can get your chemo anywhere. It's just,
yes,
it's a formula. The
yeah.
surgery, because it's a non-skin sparing radical mastectomy, some doctors find it hard to do that to someone young.
Mhm,
It makes them, they'll say things like, oh, you sure you want to save a little bit of skin? You might want that breast back, things like that. Um, because MD Anderson does this so much, or the Dana Farbers of the world do this so much, I think they're a little bit more comfortable doing that to younger women. They kind of get the big picture.
mhm,
The radiation is something a lot of women do like to travel to get if they can, because Dr. Wendy Woodward is at MD Anderson, and she's the most
mhm,
published scientist on IBC radiation, and it's a different path. It's a much more concentrated dose. Again, something
mhm.
people aren't used to doing.
Yeah.
That formula can be taken back locally, but tell me, what was that experience like? Because a lot of doctors tell patients, if you've had a good response to chemo, you've had a good response to surgery, you can skip radiation. And each step, I see you nodding your head now. Yeah, because each step is its own individual magic, shall we
Mhm.
say. So, what was the radiation like for you?
Yeah. So I did do the consult with Dr. Stouter, who works with Dr.
Mhm.
Woodward at MD Anderson. And then I,
Trained Wendy
again,
Woodward, by the way. He trained Wendy Woodward.
oh, okay. So that's great. Yeah. So I took that back home to my Northwestern radiation oncologist and said, okay, they want to do 44 radiation treatments twice a day, Monday through Friday, for 5 weeks. And he's like, I don't think, he's like, you had such a good response to the chemo and to,
Mhm. Just what I said. I called it.
yeah. And my alarm bells were going off and I'm like, crap, I'm going to have to pack my bags and be gone for a month, which I knew. I was like, if this is one time to be selfish and take care of myself, and if it means being away from my family and it gives me more time in the long run, I'll do it. So I did
I
do
always
that.
tell women, if what would you do if it was your kid,
Mm-hmm.
right? And I know I heard what you said. I get it about being selfish. I always tell women, put yourself at the front of the line.
Mm-hmm.
You know, give yourself this chance for your long-term wellness. This investment in this treatment right here is going to let you be here for years to come.
Mm-hmm.
But I think women find it hard to do that because we want to serve our families. We want to serve, and so I'm glad that you put yourself to the front line and gave yourself that radiation. What was
Yes.
radiation like? For me, it was tough. How was it for you?
It was pretty tough. I feel like people downplayed it from other people I've talked to, like, oh, this is the easiest part of the 3 steps, but it was really intense. I had a lot of struggle getting my arm up over my head still from after surgery. I was working with a physical therapist, but it was uncomfortable to keep it raised for 20 minutes at a time. And that I was worried it was going to delay me, but luckily they worked with me on that. And then as I got going, um, I started to get burns like in my armpit, and it was just really uncomfortable to put my arm up or down or wear anything that touched my armpit. It was just really uncomfortable. And then just I was working remotely, so having 2 appointments a day and sometimes 3 or 4 appointments a day, it was hard to juggle. But one positive out of that is I met 2 really good friends in the radiation waiting room who also had IVC. And so that was a plus of the experience. I was able to hang out with them and spend time together with them too. So,
Not you. I found radiation tough. And again, people downplayed it. I found the fatigue to be something that really surprised me. I just
mhm,
slept. I wasn't depressed. it just, you know,
tiring.
but my skin healed very quickly. And
Mhm.
and it was sort of a head trip, like, whoa, did this just even happen to me?
Yeah.
How was that for you as the skin started to heal?
It only took, like, I would say the week after I finished radiation, it continued to progress, like getting a little bit more painful in my armpit. And then after that, it started to heal. So I just kept applying the creams, and I had like a big bandage thing on my chest so I could wear a bra more comfortably. Um, but it only took, yeah, about a month for my skin, and it looks pretty normal now, like not really discolored.
I don't know, trippy though to think what all you've been through. Now, where
Mhm.
are you now? What is the official
Yes.
status of the disease?
So I am currently no evidence of disease, which I'm very proud of since after radiation.
Yippee!
Yes, very happy to be NED. I took a oral chemo after finishing radiation, capecitabine or Xeloda. I took 8 cycles of that. That was actually more difficult than I was expecting to. And I don't know if it's just the years worth of stuff my body went through, but that pill was really hard for me. And it actually was the first time that I took time away from work was when I was doing my Xeloda. I was like, I just need to rest. So I took 6 months of short-term disability while finishing that up. And I forgot to mention that I was treated, I kind of had two different results from my biopsy as far as the cancer markers, the tumor markers, because my breast was almost triple negative. It was 8% ER positive. So they treated me as triple negative, but my lymph node biopsy was ER positive and PR positive. So MD Anderson's like, you're a unique case of a unique case. So we're going to treat you as triple negative, but eventually we're going to want to do something about that hormone positivity that was there in the beginning. So I continued on a chemo pill for 8 cycles, finished that, and then I started the the tamoxifen, the hormone, is it
Mhm.
suppressor, I guess, that kind of puts me into menopause because I'm young and obviously was still getting my period. So that put me into menopause. And then I just switched from tamoxifen to letrozole, which has better proven results in some studies. And I also get a monthly shot of Trelstar, that's a hormone suppressor. So all of that works together to address the hormone positivity that was there in the beginning. And as Dr. Ozzie said, she's my oncologist at MD Anderson. She's like, we're just going to cover all the bases. And I was like, throw it all at me. I'm handling
Right.
it
Isn't she
well.
great?
Yes, I love her so much. She's the best.
She's terrific. And she's so into the science and so into all the clinical
Mhm.
trials and things like that. Have they tested you for any BRCA mutation or
Yes, luckily I tested negative. I do not have that. So I just was lucky.
none of that? I have women who call me all the time and say, I'm negative for BRCA, just like you just said. Um, but 90% of women with known breast cancer have no mutations. So it just shows we don't know yet. So I always
Mhm.
want people to feel like if they are positive, it's not a death sentence. Sometimes it just gives you the warning bell. I have no family history of cancer.
Yeah.
I'm from a really large family, but I'm from a family of very young people. My mama was a very young teenager, which meant my grandmother was a young grandmother. Everybody was young. I'm BRCA positive, and we don't know where that came from. So out
Mm.
of my three daughters, one, as we chose, she got the short straw, but it gives her a place to be monitored. If I'd known I was BRCA positive, I could have maybe been monitored sooner. Ironically, I had cancer both my breasts, two different cancers. IBC saved my life.
Mhm.
But, I think it'd be interesting for you to watch the developing science because you're young and you're
Yeah.
well and you're going to be here a long time. And
Yes.
maybe part of what they follow on you will help make a discovery that can help the next person. So it'd
Yes.
be
And
kind of cool to stay clicked
I do
in.
participate. There was a few clinical trials where like I could give my blood and my tissue after my mastectomy. Like I was like, take it all, please. So every time I still go to MD Anderson every 3 months to get checkups, and they'll pull all of my blood for, their research because I want to be part of moving the science along.
Well, I understand that. Well, so
Mhm.
what is next for you? I think you told your story beautifully.
Thank you.
We haven't gotten into too much of any like hardship of it all. I mean, it's been a bit of but is there anything that you feel like that you want to share, or if there's something that if someone's listening to this is going through it, that you kind of want them to understand? Because I always say that IBC patients are the true experts in this disease.
Mhm.
We're the
I
true
think
experts.
I think that something that I learned is that hope looks different at every stage, but making sure that you can hold on to that hope is really important. I know a positive mindset alone is not going to cure cancer, and it's okay to have bad days and not smile through it, but even on your hard days to keep hoping. And I was actually at a retreat that MD Anderson hosted for advanced breast cancer, and one of the clinicians there was saying that In the beginning, hope can be, I'm hoping for a cure. And maybe hope looks like I want to keep this mastitis or the metastases in my bones to where they're at now, or I want to find the right drug. I hope that I can manage these symptoms, but just always trying to find the hope of whatever stage you're in and holding on to that and not letting the disease define you. So I was really trying to keep living life with my kids and going on the trips that we had planned and enjoying as much time as I could, even going through treatment. We actually, through this process, adopted my niece as well, who's now 14. She was 13 when we adopted her. So we didn't pause our lives because of this. And if I could do it all again, I wouldn't change any of that. I'm so glad we got to keep living through this diagnosis. And I kind of try to balance living life normally, but then also recognizing that I have this diagnosis and living life even more fully than I would if I didn't. So trying to live more in the moment and prioritize, less work, more family, and taking those trips I want to take, thinking about, I want to be in the pictures. I don't want to be taking all the pictures of
I
my kids.
understand.
So it's kind of like thinking ahead a little bit about like legacy work but also living in the moment and hoping that I have many, many more years here with my family. So it's kind of a balance of that. But I would say for people going through it, even when it's scary, something that helped me have less anxiety was actually doing kind of the end of life planning, which nobody wants to talk about, but doing the will, the trust, your end of life wishes, making sure all of our custody and paperwork stuff was finalized. Nobody wants to do that stuff, but once it's done, and life insurance, all of those things, now I don't have to worry about that. So
I would say that because people, I found when I wanted to talk about if I died, a lot of
mhm,
people tried to shut me down. They were like, "Well, we want you to have hope." I am having hope, but that's just practical grown-up stuff, I call it.
yeah.
It's something I think we need to be thinking about at any age, whether we have a cancer diagnosis or not. I don't think America does death well. We don't do
Mhm.
grief well. I think that's where support groups are very valuable, like the women you met. There's a certain reality that we can have. It doesn't mean we're giving up hope. It
Mhm.
doesn't mean, but also too, I see the other end where sometimes we're pressured. I call it to seize the day mentality, where every day we have to make a memory. Every day, it's like no, that's too much pressure.
Yes.
And it can be a little frantic, and it can really take away from what I consider true memories that
Mhm.
your children will remember, that your wife will remember.
Mhm.
And so, but there's no reason that you're not going to live a long time now.
Yes.
Yay. You've had a good response. You're
Yes.
under good monitoring.
Mhm.
So, and I'm distracted by the paintings over your shoulder. I know that people are listening on Spotify can't see, so you can watch on YouTube. Is someone in your family an artist?
No, I actually bought these at a thrift store recently.
You can see my gallery wall behind me. All of
Yeah,
this is thrifted and they're
I
beautiful.
love
And
it.
I love thrifted
Oh,
art and they're
thank you.
beautiful.
Thank
So you
you.
see, I think joy and beauty and hope and all those things are part of our legacy.
Mhm.
And it's not about the pressure of,
Right.
making a special trip or whatever. Just that every day, how you live your life is a great witness. Well, how do you want to wrap this up?
I would just wrap this up as saying, I'm a social worker and I believe in advocating for causes that need advocating for. And I think IBC, I shout it from the rooftops to everybody that I meet, especially my friends who are pregnant and things, like really watch out for changes in your breasts. It's not, cancer's not just a lump. It can look like, this orange skin kind of effect, the dimpling of the skin. And I've learned about IBC and made myself knowledgeable, and I just want to pass it forward to as many people and women as I can. And I try to do that with women online that I meet and other people that I've met in person at MD Anderson, and just try to help keep advocating for this.
It's important because you mentioned pregnancy. We've not talked about that a lot, but cancer doesn't care how old you are.
Mhm.
Cancer doesn't care if you're pregnant. And we like to think of pregnancies as wonderful little bubble of joy.
Yeah.
but cancer doesn't care. And it can confuse um, the situation where, someone's never had a baby before, the breast is swollen, and you think, oh, this is normal. Or maybe even if you've nursed before, like you and me, and we've never had mastitis, we don't know. And just so people know, when you have mastitis, you'll have a full body temperature.
Yeah, I didn't have
But with
that.
IBC, just the breast is hot.
Hmm.
So, it's not necessarily a bad thing to be put on antibiotics for a few days um, in the process of getting more testing. But there is a little bit of a confusion. Dr. Wayno calls it the antibiotic mystery. It's not been written about much, but where the symptoms appear to subside on the antibiotic and they go, oh, maybe this is it. But what they realize is the moment she goes off those antibiotics, that it blows back up. So
Hmm.
they don't know why that happens. But just so people know, if someone should have mastitis, which is a very normal infection in nursing, you'll have a full body temperature, not just a hot breast. So that's that red flag to look at. But I think it's wonderful that you're sharing your experience because I'm a big believer that knowledge is power and women talking to women is often the first step in getting something done. They could
Yeah.
say, and I know someone's going to listen to the story, they're going to contact me or
Mhm.
contact you and say, I had a problem, or I didn't know what to do, or I didn't know what doctor to go to, or I was scared to go to MD Anderson, or I was scared to go to Northwestern,
Yeah.
and you've made it easier.
Yes. Well,
So
thank you.
you're going to be
I
a
always,
lifesaver.
yes, you have to advocate like your life depends on it because sometimes we'll
Yes.
take what the doctor tells us as final word, but if you don't have a good feeling about it, keep pushing.
That's a great way to end it. Well, Sarah, I really appreciate you taking the time to chat with us. I want to come and see you in Chicago. I want to have a
Yes.
meetup. Let's get a few Fridays
Anytime.
together.
Yes.
I'd love to do it. I'd love to meet your family. And
Hmm.
thank you for what you've shared today. And I hope that once the link goes live, you'll share it with your friends and family. And I'm very proud of you for taking this time to visit with us today.
Thank
Okay.
you so much.
And I'm going to end the recording now.